downstairs? Okay. All right. And how long has this been going on? Okay. Oh my. What else have you done that hasn't worked? What are you concerned this might turn into?
Surgery, I want injections. I've had hip replacement and surgery here. Just replace.
Okay. And you feel the surgeries? You want to do another surgery? Okay. So if you would please, we're going to observe you if you can go right, just walking kind of back and forth here. As you walk, do you notice any bothersome symptoms or stiffness? What do y'all notice out there on that left leg? Looks somewhat even, but that left leg just doesn't quite accept weight the same way. Maybe hard for you to see that, but all right, come on over here. What I'm going to have you do is turn your face that way. What I want you to do is bring your feet apart a little bit, and only go so far as you can comfortably without bothersome symptoms, and go into a squat as far as you can. Come back up. What prevents you from going further? Painful. Okay. So we're going to take a look at how much you can bend once again. Go ahead and bend that again. Okay, so she gets to about 60 degrees of knee bend. And on a scale of 0 to 10, how bothersome is it? An 8. Okay. All right. Have a seat right here, please, sir. Now, if she was coming in as an actual patient, we'd obviously spend more time talking about a whole number of things, right? But we're going to go right into it. So I'm going to test the length and strength of your legs. Go ahead and straighten this leg out. Hold your leg straight. Don't let me move you. We're checking out the strength of her leg on her right side. Hold on the edge of the table. Now push your leg up again. That's one strong leg. What type of work do you do? What type of work did you do?
I worked at the hospital.
What'd you do? Supply. Sure, busy on your feet.
Yeah.
Straighten out your left leg. Hold your leg there. Don't let me move you. You don't like that so much, do you? Push your leg up to straight. Push, 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 push. Not so much oomph there, is there? If you would, I'm going to have you take off your shoes. Lying back here, please. All right, so I'm going to just check out mobility of your hip, ankles, and knees here. So if you would, straighten out your left legs to the extent you can. All right. So I'll stand on this side so you can see. Would you scooch towards me a little bit? Thank you. First thing I'm going to do is we're going to just see what her flexibility is like in her hip, ankle, and knee. So her thigh comes up well past her hip. So you got some in and out motion. Every healthy knee should have the ability to have full motion, the ability to take end range over pressure. She's probably already thinking to herself, I don't think we're going to do that to my other knee. And then she'll also take end range over pressure the other way. I'm putting a fair amount of pressure on it. That's a normal, healthy knee. That's what we need to do in daily life. Pull your toes up towards your head, way up. And that's close to 15 degrees of bend here. Maybe 13 degrees. Get the measuring device out, but I'm pretty good at this after a few decades, right? Check out your other knee. I'm not going to do anything sudden, tricky, or forceful. Just got to develop some trust here real fast, right? Definitely some tightness in this hip, right? So it's noteworthy. It's probably not causing all of her pain, but that thigh doesn't come up as fast as far as the other one. Now we'll only go as far as it's comfortable and easy. She's not giving this out. A little bothersome there? Okay. So clearly a big difference between one side and the other side. The other side probably bent to about 130, 135 degrees. This one we're barely making it to 100. When we straighten it, she doesn't even like it straightened all the way, right? So we're going to take a look at a couple of things here. front thigh muscle. Kneecap can slide up. All good. Do the same thing on this side. And kneecap can move fairly well. Leave that go. So she has significant limitations in being able to bend that knee. Would you bend your other one up too? So what I'm going to do, the first thing I'm going to do is a gentle technique called joint mobilization. I'm going to work with the joint tissues to free up that joint capsule. Because, what was the original injury to this? Just developed?
Just developed.
Just developed. And then you said you had which hip was replaced?
My right.
Your right hip was replaced?
Collapsed. My hip replaced.
Got it. So she's got some stiffness in her hip here. So it may be that over time, recovering from a hip injury, some tightness in this hip, she got a little kitty wampus in her walking. I don't know. I didn't know her 10 years ago, so I don't know what the development is. But there's no direct trauma. So what I'm going to do is I'm going to do some gentle work for this, and what I'm going to do is I'm going to just do some real gentle joint mobilization techniques. Now you're going to probably feel here there's a certain amount of stiffness and mobility there that's quite different than the other side. You feel that difference? Like it's hard for you to see there, but all I'm doing is she's laying down like this. All I'm doing is seeing how much flexibility she has in that joint capsule. Okay, now small movements, you're not going to see much from there, but she's got a fair amount of stiffness there. I'm actually going to stretch her kneecap out a little bit, her leg out a little bit. How is this? That's painful? Yeah. Well, we don't want to do anything that's painful. She's like, I agree with that. How is this? Afterward? So I'm just working, just shifting that knee forward and back a little bit, real gently. As we continue with this, what do you notice? I feel like it's relaxing a little bit. Again, this is called joint mobilization. These are specific hands-on techniques designed to help improve the flexibility of the joint and relieve pain, to encourage more healthy movement, to reduce inflammation and pain. Remind me again how long this has been stiff?
About a year.
About a year. Bend this knee up. Now, straighten this leg out. Straighten this leg out. What does that feel like now? Let that leg rest a bit straighter. Does it feel any different than before? How so?
It's more relaxed.
More relaxed. And how is this now? Still hurts. Does it feel like it moves a bit further?
It seems to be, yeah. A little
Her eyes aren't nearly as big now.
bit.
What do you notice about how far it bends now compared to before? You got good eyes. You got good.
Better movement?
Yeah. I'm happy with that. I don't think we're going to get all that on one day. But the fact that A, we're able to find something from a movement perspective, B, be able to start to mobilize your knee a little bit in a gentle way, her body seemed to accept. That's a win. So, good news, there's hope for you. Have a seat, please, on the table. What we're going to do then is we're going to test this now. We're going to test the strength of her leg, both while she's sitting on the chair or sitting on the table here, and while she's doing the squat. So once again, straighten out your left knee. Hold the edge of the table, please. Don't let me move you. What do you notice about the strength there now?
It's a little bit clearer.
Yeah, absolutely. She didn't pull back, and I didn't feel like I had to stop because it was causing her irritation. I like that. So you were walking and did your squats before with your shoes on, so I'm gonna have you slip your Skechers on. I think they're Skechers, no?
Yeah.
I think with all the people that I know buying Skechers, I'm gonna go buy some of their stock if there's a stock offer. Come on up to standing. Just notice what your sense of standing is like on that leg before we do anything.
I have more pressure on it now.
Put a little more weight on it.
Yeah.
Force is kind of shifting some weight off of it. Now take a walk back and forth. What do you notice about our walking speed?
Increased.
More relaxed.
You don't have to be a trained clinician to see when people move better. We're biological animals. Like we can recognize when people are struggling with movement, right? So that's great. Now I want you to see what you can do with that squat once more. A little bit more. That's deeper squat for the win, Alex. Nice. What do you think?
Good.